Question 1. A patient recovering from abdominal surgery complains of shortness of breath. What should the nurse do first? A. Notify the provider. B. Encourage coughing exercises. C. Raise the head of the bed. D. Apply a warm blanket. Answer. C. Raise the head of the bed. Question 2. Which medication should the nurse question for a patient with a history of asthma? A. Albuterol. B. Ibuprofen. C. Montelukast. D. Fluticasone. Answer. B. Ibuprofen. Question 3. A nurse is caring for a patient with a chest tube. Continuous bubbling in the water seal chamber means A. System is working correctly. B. Lung is fully re-expanded. C. There is an air leak. D. Suction is too low. Answer. C. There is an air leak. Question 4. Which intervention is appropriate for a patient with thick pulmonary secretions? A. Limit fluids. B. Use humidified oxygen. C. Encourage bed rest. D. Restrict sodium intake. Answer. B. Use humidified oxygen. Question 5. A patient's oxygen saturation drops to 86%. What is the nurse's priority action? A. Encourage coughing. B. Apply supplemental oxygen. C. Call the respiratory therapist. D. Increase for fluids. Answer. B. Apply supplemental oxygen. Question 6. What is the most important intervention to prevent atelectasis postoperatively? A. Administer antibiotics. B. Encourage incentive spirometry. C. Maintain for hydration. D. Offer high-calorie meals. Answer. B. Encourage incentive spirometry. Question 7. A nurse hears crackles in the lower lobes. What does this most likely indicate? A. Asthma. B. Pulmonary edema. C. Pleural effusion. D. Pneumothorax. Answer. B. Pulmonary edema. Question 8. Which instruction is most important when teaching a patient to use a peak flow meter? A. Inhale slowly before blowing. B. Use after meals. C. Record the best of 3 readings. D. Blow out gently. Answer. C. Record the best of 3 readings. Question 9. What is the earliest sign of respiratory compromise in a postoperative patient? A. Cyanosis. B. Confusion. C. Wheezing. D. Bradypnea. Answer. B. Confusion. Question 10. A patient with pneumonia has thick secretions. Which nursing intervention is most helpful? A. Increase fluid intake. B. Provide antipyretics. C. Limit activity. D. Use cool mist therapy. Answer. A. Increase fluid intake. Question 11. Which complication is most likely after thoracentesis? A. Pulmonary embolism. B. Pleural effusion. C. Pneumothorax. D. Bronchospasm. Answer. C. Pneumothorax. Question 12. Which symptom in a tuberculosis patient indicates the need for immediate isolation? A. Chills. B. Hemoptysis. C. Low-grade fever. D. Chest pain. Answer. B. Hemoptysis. Question 13. A COPD patient complains of difficulty breathing while eating. What should the nurse recommend? A. Eat large meals quickly. B. Avoid fluids with meals. C. Use bronchodilator before meals. D. Lie flat after eating. Answer. C. Use bronchodilator before meals. Question 14. A nurse notices asymmetrical chest expansion. What could this indicate? A. Bronchitis. B. Pleural effusion. C. Asthma. D. Pharyngitis. Answer. B. Pleural effusion. Question 15. What is the purpose of chest physiotherapy in patients with respiratory illness? A. Improve appetite. B. Break up secretions. C. Reduce anxiety. D. Control infection. Answer: B. Break up secretions. Question 16. A patient receiving high-flow oxygen reports tingling fingers and dizziness. What should the nurse suspect? A. Hypoxia. B. Hypercapnia. C. Oxygen toxicity. D. Hyperventilation. Answer: D. Hyperventilation. Question 17. Which factor increases the risk for hospital-acquired pneumonia? A. Use of incentive spirometry. B. Early ambulation. C. Prolonged immobility. D. Adequate hydration. Answer: C. Prolonged immobility. Question 18. What is the nurse's priority when caring for a patient with respiratory stridor? A. Elevate the head of the bed. B. Monitor SpO2 every hour. C. Prepare for emergency airway. D. Administer 4 fluids. Answer: C. Prepare for emergency airway. Question 19. A patient with a tracheostomy is choking while eating. What is the nurse's immediate action? A. Suction the airway. B. Increase oxygen flow. C. Notify the provider. D. Stop the feeding. Answer: A. Suction the airway. Question 20. Which action is most effective in controlling the spread of tuberculosis? A. Wearing gloves during care. B. Administering antibiotics. C. Placing the patient in negative pressure room. D. Encouraging deep breathing. Answer: C. Placing the patient in negative pressure room. Question 21. A patient is admitted with a tension pneumothorax. What is the nurse's priority action? A. Administer 4 fluids. B. Prepare for needle decompression. C. Elevate the head of the bed. D. Apply a non-rebreather mask. Answer: B. Prepare for needle decompression. Question 22. Which finding requires immediate intervention in a patient with COPD? A. Use of accessory muscles. B. Clubbing of fingers. C. Pursed lip breathing. D. Respiratory rate of 10 breaths/min. Answer: D. Respiratory rate of 10 breaths/min. Question 23. After bronchoscopy, which assessment is the nurse's highest priority? A. Presence of gag reflex. B. Blood pressure. C. Oxygen saturation. D. Sputum appearance. Answer: A. Presence of gag reflex. Question 24. A nurse is delegating care of a patient with stable asthma. Which task is appropriate for a UAP? A. Administering albuterol. B. Monitoring peak flow. C. Assisting with bathing. D. Assessing lung sounds. Answer: C. Assisting with bathing. Question 25. A patient with emphysema is restless and confused. What should the nurse do first? A. Check oxygen saturation. B. Notify the provider. C. Give prescribed bronchodilator. D. Reposition to high Fowlers. Answer: A. Check oxygen saturation. Question 26. A nurse auscultates wheezes in a patient with asthma. What is the best explanation for this sound? A. Fluid in alveoli. B. Air moving through narrowed airways. C. Lung collapse. D. Air trapped in pleural space. Answer: B. Air moving through narrowed airways. Question 27. Which teaching should be included for a patient using a metered-dose inhaler MDI? A. Breathe out quickly after spraying. B. Use a spacer for corticosteroids. C. Take 2 puffs every hour. D. Hold breath for 2 seconds. Answer: B. Use a spacer for corticosteroids. Question 28. Which lab value supports the diagnosis of respiratory acidosis? A. pH 7.50. PaCO2 30 millimeters of mercury. B. pH 7.28, PaCO2 55 millimeters of mercury. C. pH 7.42, PaCO2 40 millimeters of mercury. D. pH 7.38, PaCO2 35 millimeters of mercury. Answer: B. pH 7.28, PaCO2 55 millimeters of mercury. Question 29. A patient is on a ventilator. The high-pressure alarm sounds. What should the nurse do first? A. Call the respiratory therapist. B. Check for kinks in the tubing. C. Silence the alarm. D. Suction the airway. Answer: B. Check for kinks in the tubing. Question 30. Which dietary recommendation is best for a COPD patient with weight loss and fatigue? A. High protein, small frequent meals. B. Low calorie, low carb meals. C. Large meals 3 times daily. D. High fiber, low fat meals. Answer: A. High protein, small frequent meals. Question 31. What is the nurse's priority action for a patient experiencing an acute asthma attack? A. Obtain chest X-ray. B. Administer a rescue inhaler. C. Start 4 fluids. D. Position the patient supine. Answer: B. Administer a rescue inhaler. Question 32. A patient with cystic fibrosis reports thick sputum. Which is the most helpful intervention? A. Increase dietary fiber. B. Encourage postural drainage. C. Reduce fluid intake. D. Provide cold mist therapy. Answer: B. Encourage postural drainage. Question 33. What is the best position to promote oxygenation in a conscious patient with pneumonia? A. Prone. B. High Fowler's. C. Trendelenburg. D. Supine with legs elevated. Answer: B. High Fowler's. Question 34. What does a pulse oximetry reading of 88% in a COPD patient indicate? A. Acceptable range. B. Need for supplemental oxygen. C. Imminent respiratory arrest. D. Hypocapnia. Answer: B. Need for supplemental oxygen. Question 35. A nurse is caring for a patient post-lobectomy. What intervention helps prevent respiratory complications? A. Encourage bed rest. B. Offer ice chips frequently. C. Promote use of incentive spirometer. D. Limit oral intake. Answer: C. Promote use of incentive spirometer. Question 36. Which symptom requires immediate intervention in a patient with pulmonary embolism? A. Productive cough. B. Sudden chest pain and dyspnea. C. Low-grade fever. D. Fatigue and malaise. Answer: B. Sudden chest pain and dyspnea. Question 37. What nursing action reduces aspiration risk in a patient with dysphagia and a history of aspiration pneumonia? A. Encourage thin liquids. B. Place in supine position during meals. C. Provide thickened liquids. D. Feed quickly to avoid fatigue. Answer: C. Provide thickened liquids. Question 38. A patient with carbon monoxide poisoning is receiving 100% oxygen. What is the goal of this therapy? A. Raise CO2 levels. B. Displace carbon monoxide from hemoglobin. C. Prevent infection. D. Improve ventilation perfusion mismatch. Answer: B. Displace carbon monoxide from hemoglobin. Question 39. A nurse is reviewing ABG results. pH 7.30, PaCO2 60 millimeters of mercury, HCO3 24. What condition does this indicate? A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. Answer: C. Respiratory acidosis. Question 40. A patient reports using 2 pillows to sleep and waking up breathless. What term describes this symptom? A. Bradypnea. B. Orthopnea. C. Apnea. D. Dyspnea on exertion. Answer: B. Orthopnea. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.